Now, to enlighten us,
Of its kind, total ankle replacement surgery performed at Narayana Healthcare. So, ankle arthritis is one of the common problem we see in our orthopedic practice, and the prevalence worldwide is nearly 1% of population, and 10 to 13% of people aged more than 50 years do suffer from ankle arthritis. It's a quite debilitating condition with a lot of pain, restricting their daily activities of living, and we needs to be addressed. Ankle fusion, also known as ankle arthrodesis, is no longer accepted as the gold standard procedure for addressing this problem, because this leads to a lot of morbidity, restricting the movement and also affecting the quality of life. And also this leads to development of arthritis of the adjacent joints of the foot. Hence, the ankle replacement came into existence. Earlier results of this total ankle replacement surgeries were highly disappointing, owing to the high complication rates and failure rates. However, with the development of newer designs and improved surgical technique and expertise training, the present day outcomes are very much satisfactory. This total ankle replacement surgery is a quite common known entity in US as well as European country. However, very rarely these kind of surgeries are performed in India. From last 2 years, it has gained momentum in our country. With this background, I'm going to share the success story of the total ankle replacement surgery performed first of its kind in Bengaluru at Narayana Healthcare. So here goes a 64-year lady who came with pain in her left ankle, suffering from quite a long years, and she had an injury in the past, quite a long back, for which she underwent surgery, and later on some metal work was done which were again removed. But however, day by day the problem got aggravated and she was suffering a lot, which affected her daily activities of living as well. And when I examined her, she hardly had no movements at all in her ankle. You can see in the picture, no movement happening at the ankle joint. The ankle joint was totally stiff, and that's how she walks. She was walking before the surgery with quite a lot of pain and limping. And we do scoring system based on AOFS, that is American Orthopedic Foot and Ankle Society scoring, where 100 is considered as normal based on the pain level and the activity level, and it was 32 out of 100. I had a lot of discussion with her, explained about the pros and cons of surgeries, and ultimately she agreed because she wanted some movement in the ankle joint. Because ankle fusion, as I said before, it leads to complete restriction of the movement. But however, she's a quite active lady. She wants to participate in a lot of social events and other things. So she wanted to have a range of movement in her ankle. So that's why we decided to go for ankle replacement surgery. And these are the technical steps which I'm going to tell you briefly. So I opened the ankle joint from the front. This is the incision, and that's how we do. After opening, we use a certain jigs which are meant for taking certain cut in the bone in a proper manner. And we always use image intensifier, that's also called a SIAM machine, inside the operation theater, where we can exactly access the surgical techniques. And this is how it looks. Hi, I am here to share the successful story of me performing a total ankle replacement surgery, first of its kind in Bengaluru at Narayana Healthcare. And she is Mrs. Jacinta, a 64-year-old lady who presented with a lot of pain in her ankle, and when I examined her, the ankle was completely freezed. She had a history in the past because of which she developed end-stage ankle arthritis, and there was absolutely no movement at all, and she had a lot of difficulties in performing her day-to-day activities. And the X-ray was also looking very bad, and that's how, after my clinical assessment and examination, I offered a surgery called total ankle replacement surgery, wherein we can regain the ankle movement and also get away the pain. And I explained her about the procedure. However, before coming to me, she had consulted so many surgeons at her place, and everyone has suggested ankle fusion or ankle arthrodesis, where we fuse the joint, and after that they don't have any movement at all, and still they have some morbidity. So this is quite different from the regular ankle fusion techniques we perform for the ankle arthritis. So after discussing, I'm taking the consent and went ahead And however, there was a challenge wherein we need to get the implant because the ankle replacement implant is readily not available in our country. So there was another challenge where I had to write to the company from US and Netherlands where they manufacture, and had to take a permission from the Drug Control Authority of India to get it imported to our place. And finally it came. So it, a lot of paperwork. It took around 3 weeks time, and we got the implant, and we planned a surgery on a particular day and performed the surgery. And immediately after surgery, she was put on plaster for 15 days, and later on we removed and we mobilized the ankle and allowed her to take weight. And after 6 weeks, she was completely pain free, and she was walking without any support at all. At 3 months, absolutely no pain, and she was still more comfortable. And present situation, you can see her now, and you can hear from her as directly.
But how is it for the first time you perform this surgery? So how do you feel like performing for the
No,
first
no.
time?
This is I'm not perform. I see. In India, I performed for the first time, but I am used to this surgery in England, where I was undergoing training in Scotland. So I have done quite a lot of ankle replacement surgery. But however, this is first in India. After me coming back to India, like I've performed this one. So definitely, I was not like nervous or anything. It's not a first for me.
I'm Mrs. Jacinta Agnes Mascarenas. I'm from Goa. This is a very long story, of course. Was going through a very bad phase of pain, and I went to many doctors, and many. All were telling me fusion, but fusion. Then one of my orthopedic doctor who did my knee. I have done a knee replacement also. So he showed me how will I walk after getting infusion. So I said, I don't want this way walk. I want how I walk, the natural way. Then he was trying, then no. Then as I told you all, my daughter, her friend and my niece, they all got together, and they somehow they told me, Mama, you just come here, you just see. You meet doctor and you see, and if you like it, you will go ahead. There is no problem. So much pain you have already taken. Why you want to go for a fusion? Because I was ready to go for a fusion because my leg was paining too much. I just couldn't bear it. And then I came and met Dr. Shekhar. He seen my leg, and he immediately told me, oh, it's very bad. And then he took the x-rays and everything, and he said, will you do the ankle replacement? I said, yeah. You know that I have not done in India, but I am a doctor who has done there. I said, doctor, there's no problem. I have faith in you, and I know you will do it, because in India nobody does this. And so it happened. Today I am here with you all. I couldn't walk, I couldn't climb a staircase, nothing. But now, in another 6 months, 6 months, I am doing everything. Everything, absolutely everything. Running, dining, walking, talking, everything. So I would thank Rudla, Narayana, and those three little who brought me to Dr. Shekhar, and of course Dr. Shekhar also. And the hospital took very good care of me, and the whole hospital, everybody, the whole team, they were all with me. They helped me for everything, for the part, everything they helped me. So I had no problem with anything, and I say thank you very much.